Oh no, he's coming.
Hi, my name is Sheekha. I'll be your student physical therapist today, and I'll fit you to a wheelchair.
Things to consider when fitting a patient in a wheelchair. Making sure the patient is at the optimal position, whether it be supine or the hips, knees, and ankles be at a 90 degree angle. Making sure to accommodate to the patient's apparel. Making sure the patient's pelvis is leveled and well positioned. Making sure the patient is not sacral sitting. And making sure the physical therapist does not contour the tape to the patient's body. What to measure for wheelchair fittings: seat depth, seat width, seat to floor height, seat back height, and armrest. Seat depth. Seat depth is measured in the supine position. It is the only wheelchair fitting measurement that is done in the supine position. Measurements are taken from the back of the hips to the popliteal fold. Once a measurement is taken, subtract 2 inches to determine the final measurement. Even superheroes have technical difficulties.
So next we want the patient to be at a 90 degree seating position. So the hips are at 90, the knees are at 90s, and the ankles are at 90.
Seat width is measured in the 90 degree position. Measurements are taken from the distance between the two outside edges of the hips. After a measurement is taken, add 1 to 2 inches to determine the final measurement.
So next we're going to measure seat width. So I'm going to have you place your hands on the side of your hips. We're going to measure from one hand to the other. Perfect.
Seat to floor height is also measured in the 90 degree position. Measurements are taken from the sole of the foot to the popliteal fold. If there is a cushion being used in this wheelchair, the thickness of the cushion must be subtracted. Once a measurement is taken, add 2 inches to determine the final measurement.
So next we're going to do seat to floor height. So we're going to measure from the sole of the shoe up to the popliteal fold.
Seat back height is also measured in the 90 degree position. Seat back height may vary depending on the patient and the level of support the patient needs. For a standard wheelchair, measurements are taken from the seating surface to either the inferior angle of the scapula or to the axilla. If the seating surface to the axilla is measured, subtract 4 inches to determine the final measurement.
Alright, so next we're going to measure the seat back height. So that is going to be from the seating surface up to the axilla. Another way to measure a seat back height is to do it from the seating surface up to the inferior angle of the scapula.
Armrest height is measured at the 90 degree position with the arms positioned close to the trunk and bent at the elbow at a 90 degree angle. Measurements are taken vertically from the olecranon process to the seating surface. If there is a cushion being used, add the cushion height. Once a measurement is taken, add 1 inch to determine the final measurement.
Lastly, we're going to measure the armrest length. So we're going to have the patient flex the arms at 90 degrees, keeping the arms close to the trunk, just like that. We're going to measure from the olecranon process down to the seating surface.
Now, how to confirm wheelchair fittings. Observe the patient sitting in the wheelchair. Confirm measurements with a 2-finger test for seat width, depth, height, leg rest length, and seat back height.
Okay, so now on to confirming. First, we're going to confirm seat depth. So we're going to put 2 fingers horizontally between the popliteal fold and the edge of the seat. Okay, so next we're going to confirm seat width. So in order to do that, we're going to put 2 fingers horizontally or vertically in between the hips and the wheelchair. Next, we're going to check seat height. So in order to do that, we're going to put 2 fingers horizontally in between the front of the seat and the distal thigh. Next, we're going to confirm leg rest length. So in order to do that, we're going to take 2 fingers vertically underneath the foot plate and the floor. Lastly, we're going to confirm back height. So in order to do that, we're going to put 2 fingers vertically in between the back of the seat and the patient's axilla.
Some things to consider.
It's a miracle!
The student was not a compliant patient, so we'll see him back on Friday.